Hello and welcome. Let's talk about tetracyclines. Tetracycline is a broad spectrum bacteriostatic which inhibits protein synthesis, and the most commonly used drug is doxycycline. Chemistry includes tetracyclines are a group of the drugs consisting of common four ring structure fused together with conjugated double bond. The free tetracyclines are crystalline amphoteric substances of low solubility. The sources: chlortetracycline is from Streptomyces aureophacine, oxytetracycline from Streptomyces remosus, tetracycline is from dehalogenation of chlortetracycline, demiclocycline from demethylation of chlortetracycline, and tigecycline is from new glycylcycline, which is a semisynthetic minocycline. Now, classification of tetracycline. Based on serum half-life, it may be short-acting, intermediate-acting, or long-acting. Short-acting includes chlortetracycline, tetracycline, and oxytetracycline. Intermediate includes demiclocycline and methacillin. Long-acting includes doxycycline, minocycline, and tigecycline. Now, this is a picture showing different types of mechanism of action of different types of antibiotics, which includes chloramphenicol, tetracycline, erythromycin, and streptomycin, acting on ribosomes, 50 ribosomes and 30S ribosomes. This is a picture showing the mechanism of action of tetracyclines. Now, mechanism of action. Tetracycline binds reversibly to 30S ribosomal subunit and inhibits protein synthesis. It enters into microorganisms in part by passive diffusion and in part by energy-dependent active transport. It binds reversibly to the 30S subunit of bacterial ribosome and blocks the binding of the charged amino acid tRNA to the acceptor site on the mRNA ribosomal complex, and thus prevents addition of the amino acid to the growing peptides. Pharmacokinetics. The absorption by oral route is variable. In case of chlortetracycline, it is 30%, and for tetracycline, 60 to 70%. The enterohepatic circulation occurs. Minocycline concentration is very high in tears and saliva. Divalent and trivalent cations are combined with tetracycline and forms the non-absorbable chelates. As a result of the chelation with calcium, growing bones and teeth are damaged. Clinical uses: for pneumonia caused by mycoplasma, most chlamydial infection and STD, gastric and duodenal ulcer caused by Helicobacter pylori, for acne, cholera caused by Vibrio cholerae, plague, tularemia and brucellosis, protozoal infection like MBBS is caused by Entamoeba histolytica, and malaria caused by Plasmodium falciparum, relapsing fever caused by rickettsial infection, Lyme disease caused by spirochetal infections, and for eradication of the meningococcal carrier state and inappropriate secretion of the ADS by certain tumors, demiclocycline is used. Tigecycline is a newly approved drug which is used in skin and skin structure infection and intra-abdominal infection. It is coagulase negative staphylococcus effective drug for Streptococci, Enterococci, Enterobacteriaceae, and a lot of other bacteria. It is not effective against Proteus and Pseudomonas, like in case of UTI caused by these organisms. Adverse effects includes nausea, vomiting, diarrhea, pseudomembranous colitis, sore mouth and throat, black hairy tongue, dysphagia, and in case of fetus and children, the tetracyclines selectively and readily bind to the calcium deposited in the teeth and growing bones of the fetus and children due to their chelating properties and causes fluorescence, yellow or brown discoloration of the teeth, dental enamel hypoplasia or dysplasia with the pitting cause malformation and increased susceptibility to caries, bone deformity and growth retardation, and in case of the adult, yellow or brown discoloration of the teeth is seen. Liver toxicity, kidney toxicity, local tissue injury, staphylococcus enterocolitis, intestinal candidiasis, photosensitization, dizziness, vertigo, nausea, vomiting may be seen. Contraindications includes children under 8 years of age, pregnant or lactating mother, renal impairment patient. Advantages of the doxycycline is that it is almost completely absorbed from GIT, bioavailability is near 100%, long half-life, long duration of action, once daily dosing, better patient's compliance, accepted by bile, and can be given in the renal failure patient. End of the topic.